Good morning, all of you. My name is Dr. Vatkar. I am a spine surgeon. Basically, I work in Navi Mumbai and Mumbai. So today I'm going to talk about how you can care about your back. And the tagline for this is take care of your back and it will take care of you. So what are the problems what we see in patients who have old age in related to spine? So the first thing what happens is as the age grows, there will be decreased physical activity. There is increased osteoporosis because the breakdown of the bone increases, maybe because of the salinity and because of the menopause in women. The cognition decreases. For example, if before in your 20s you were able to do a task in about 10 minutes, here you might take about 20 or 25 minutes to complete the same task. Additionally, there are also medical comorbidities which add on as you grow in terms of hypertension, diabetes, and other medical problems. The spine also gets degenerated. So your facet joints over there start degenerating, your discs are degenerating, and that can cause more problem. As an extension to the degeneration, there is also spinal stenosis, which is basically the area through which the nerves pass in the spinal canal. They decrease, and that causes more of pain while walking. And as there is increased osteoporosis, there are chances of osteoporotic fractures, especially in the wrist and in the hips and in the back. So in terms of the spinal issues, so we have degeneration which goes on. So here you can see these are the facet joints which start degenerating, your disc starts degenerating, and additionally when the disc starts degenerating, the annulus fibrosus, which is the outer covering of the disc, that gets injured or that gets torn apart, and the jelly-like material inside the disc that comes out, pops out, and starts impinging and compressing on the nerve and the dural sac, which causes radiation of the pain to the legs. So in terms of the lumbar canal stenosis, so basically what happens is there is a dural sac. This is a sac which contains all your nerves which go down to your legs. However, in that there is a fluid which is known as a cerebrospinal fluid. So the nerves generally float in that cerebrospinal fluid. But as the age grows, the degeneration in the bones, in the vertebral bones and in the joints which are known as a facet joint, that starts increasing, and that actually causes decrease in the area through which the nerves pass. That also causes decrease in the in the cerebrospinal fluid which is present in there, and that causes problems while walking, especially when you are walking for long distances. You start getting numbness and heaviness in your legs, which is known as claudication. This whole gamut of problems is known as lumbar canal stenosis. As I told you before, because of the osteoporosis, patients might also have osteoporotic fractures in spine, in the hip joint, and in the wrist joint. So how do you prevent these? So to prevent these, the first and the basic Guru Mantra is to do exercises. So do yoga, do regular walking, do gymming, whatever you want to do, but keep exercising. At least an exercise of about 20 to 25 minutes every day is important. Then you need to have a healthy lifestyle in terms of you shouldn't be smoking, you shouldn't be drinking excessively, and additionally you should be having a healthy diet. In terms of the healthy diet, you should be having all leafy vegetables, you should have a lot of fiber in your diet, you shouldn't be cutting down on a lot of non-veg. I mean, a small amount of regular intake of non-veg is okay, especially chicken and goat meat is okay. It is a great source of protein, but it shouldn't be on an higher side. That means you're eating it every day. In terms of the medications, very few medications are required, especially medications in terms of calcium tablets, vitamin D, or for that matter multivitamins might be prescribed by the doctor, especially in terms of uh, things as in if you have diabetes, so the patient might have neuropathy, so in those terms you need to have some multivitamins additionally with the treatment of other anti-diabetic medications. Additionally, if you have osteoporosis, you need to have some medications like calcium tablets, vitamin D, and if your osteoporosis is significant enough, it might require some additional medications like biphosphonates and injection teriparatide. Lastly, surgery. Well, the surgery, especially in the spine, is required in less than 5% of patients who have significant problems in their spine, as in they have gallbladder symptoms, their walking has been altered, their gait has been altered, there is some weakness and numbness which is persistent in spite of all the non-operative treatment modalities like medications, exercises, and injections, which we generally do for pain management. If all these things have been exhausted, then we might go for surgery. So what are the exercises, what generally needs to be done to have a healthy lifestyle? So in terms of the spine, you can have these are the Mayo Clinic exercises, like knee to chest. You just take your knee, cross it above, and try to get it as close to your chest as possible. The second is the lower back flexibility exercises, in which we sway the legs and we lift the pelvis up. Then you have the bridge exercises, in which you lift the pelvis up. Then you have the cat stretch, in which you go on a four-leg into a kind of a cat position, and you try to arch it as up as possible and try to bend it as down as possible. And then if you are in a office area, you can always do shoulder blade squeezes, and lastly you can do seated low back rotation stretches. These are especially important if you have a prolonged amount of time for which you are sitting in a chair, especially for people who work in IT or who are in banking services. Now, what are the exercises, benefits of exercises? Well, any exercise, no matter what amount of exercise you're doing, is beneficial. First of all, it prevents diseases. It helps you cut down on diabetes, on hypertension. It increases your cognition and your memory. That is fantastic in terms of you are healthy, you are able to do your work faster. It helps to prevent falls because your cognition and your muscle coordination improves. It helps to prevent falls and helps to prevent any fractures. Lastly, it helps to maintain your bone density and muscle strength. In terms of calcium, the the amount of calcium what is generally needed is about 700 milligram of calcium every day. So the good sources of calcium are milk, cheese, and other dairy foods. You can have a lot of green leafy vegetables like broccoli, cabbage, and spinach. Soya bean is a very good source of calcium. Tofu, and in plant-based drinks you can have soya milk and, with added calcium. Nuts like cashew nuts, almonds are very good source of calcium. And lastly, in non-vegetarians, like you can have fish, especially cod fish or sardines and pilchards, have very good amount of calcium. In terms of vitamin D, the normal amount of vitamin D recommended is about 10 micrograms of vitamin D every day, which you can get from fish like salmon. You can get it from egg yolks. A lot of people have that kind of a problem in terms of you shouldn't be eating egg yolk, it increases cholesterol. Well, that's a myth which has been fallen down. Lastly, you can have fortified foods and breakfast cereals. All in all, the problems in spine during as the age grows are increasingly getting problematic. So we need to have an coercive and team effort to decrease those kind of problems. Thank you. Thanks a lot.